In 2014, I was diagnosed with endometrial cancer. I was told that endometrial cancer was one of the most common cancers, but also the most treatable. Because I work in the healthcare profession, I was aware of the possible risk of something being wrong if you have any bleeding when you're postmenopausal.
I think it's important for us to learn about our bodies so we can see when something's not quite right. Not necessarily for us, but also for our other family members. So if we know that it's not normal to bleed when your periods have stopped, if your mum says, oh, I've had a bleed and I wasn't expecting that, you can encourage her to go and get something checked out. It doesn't mean that it's going to be cancer, but it could mean that you can get something treated before it develops to be a cancer.
Thinking about awareness of these cancers and thinking about education for kids, I think it's really important that young children, particularly girls and boys too, are brought up to believe that they can use the real terms for their gynaecological parts of their bodies.
So if we're aware of our bodies and we know what they should be like, and we're comfortable using the words and the terms that go along with our bodies, it probably makes it a bit more comfortable to be able to go to the doctor and say, do you know what, I've got a problem with my vulva. It itches, it's sore. It also makes the doctor understand what you're actually talking about, because we're informed and we're knowledgeable. We can support us, our friends, our family members, and also our doctors in knowing exactly what we're there for.
After I was diagnosed with endometrial cancer, I became aware of the charity, the Eve Appeal. With the support of the Yes Company, the Eve Appeal are taking you back to school to make sure that everybody has the education about gynaecological cancers, about gynaecological body parts, and to help everybody feel comfortable about talking about these issues so that the taboo is lifted.
So if I went back to school now, I would want my teachers to tell me what's normal and what's normal for me, and to encourage me to be able to check, to feel safe to check what's normal for me.
If I went back to school now, first of all, I would look a little bit too old to be there, but I wish that I'd known that there is much more to your vagina than a period coming out and a penis going in.
It's really important that both women and men are aware of the signs and symptoms of the cancers, because it might be that your partner's used a condom and there's blood on the condom but you've not looked at it. So being aware that this isn't normal and that you should need to go and get it checked out could help diagnose an early cancer or prevent a cancer.
Of the 5 gynaecological cancers, endometrial cancer is the most common, and it's important to know the signs and symptoms. These are abnormal bleeding between periods or after sex or postmenopausally. And it's very important to go to your GP as soon as you experience these symptoms to get checked out. Ovarian cancer is the 6th most common cancer, with over 7,000 women diagnosed every year. It's a difficult one to detect because the signs and symptoms are a little bit vague and varied, and they include increased bloating and abdomen feeling full, changes in and habits in bowel movements, possible vaginal pain and discomfort, persistent abdominal and pelvic pain.
Vaginal cancer is the rarest of the 5 gynae cancers. It's most prevalent in women who are over 60, and about 250 women are diagnosed every year in the UK. The symptoms are unusual discharge, so that's different for everybody, but it's a discharge that's a little bit foul smelling or an unusual colour. Whatever you think is abnormal for you is worth going to get checked out by your doctor. It's also really important to check your vagina. Pop a finger or two inside and feel around and feel what your vagina feels like on a normal day Do it regularly, perhaps once every couple of weeks. And if you notice a lump or anything that feels, again, abnormal for you, just go to a doctor, because it is so much better to be safe than sorry. Vulval cancer is the second rarest of the gynae cancers, with around 1,300 cases diagnosed every year in the UK. Again, like with vaginal cancer, it's more prevalent in older ladies, but of course that doesn't mean that us younger girls don't need to check ourselves. So the main symptoms for vulval cancer are a change in the skin colour of your vulva, so around the labia and the clitoris. If there's an unusual itch, unusual skin, so perhaps a patch of dry skin, and any lumps and bumps that aren't kind of an ingrown hair or anything that feels abnormal for you. Rub your labia between your fingers and see what the skin feels like, and then if there are any lumps and bumps, again, anything unusual for you, just go to the doctor, because your doctor, I promise, would much rather say, that's just an ingrown hair, than tell you some awful news.
Cervical cancer isn't that common. It affects about 3,500 women a year, but in an age group of about 30 to 45, it's most common, which is quite young for a lot of the cancers. So the most common type of cervical cancer is squamous cell cancer, and it's predominantly caused by a virus called human papillomavirus. So it's very common for people who are sexually active, not necessarily have had sex, but to have sexual contact, to develop HPV. 80% of the population will have HPV through sexual contact. If HPV is left untreated, it can go back to being normal if your body's strong enough to fight it. However, if it is left untreated, it can go on to develop into a cancer, which is why really you should be going for your smears, because we pick up abnormal cells before they turn to a cancer. So the signs and symptoms of cervical cancer are usually often postcoital bleeding, irregular bleeding, bleeding between your periods, or in older women, if you've stopped your periods, it could be bleeding after your periods have stopped, so postmenopausal bleeding. Other signs can be discomfort when you're having sex. So not your normal discharge, because we all have a normal smell to our discharge, but offensive smelly discharge. Pain and discomfort. And sometimes people present with a urine infection, which maybe isn't a urine infection. But all of these things can be non-cancerous. It doesn't mean it is going to be cancer, it's just worth getting it checked.
One of the issues that is not talked about and is still very taboo is the side effects that come with treatment of gynaecological cancers. This can make sex difficult and painful, and the Yes Company have developed products which can help with this issue. They're organic lubricants and vaginal moisturisers which make life much more comfortable.